Hey everyone, Dr. Miller here. Natural results don't come by accident. So what do I actively do to make sure that you get your natural results? And the first thing I do is we're going to talk about what your intended results are. Because if I don't think your results are natural, I'm not going to do your surgery. So the first thing is a unified vision of a natural result that the two of us agree on. The second thing is that I'm going to mark you while you're sitting up. A lot of doctors mark the patients when they're already lying down, and you don't want to look good lying down. You want to look good sitting up. So I know it sounds straightforward and simple, but I'm going to do a lot of my markings while you're sitting up in a chair. The third one is what I call plan but change, meaning I'm going to have a plan in my head, but I'm going to constantly assess what's going on during the surgery to see if that plan is executing what it is that you and I are trying. Number 4 is simply that just because you can doesn't mean that you should, or I do. So in other words, if I release everything, let's say I'm doing a lift, and I get a really, really big lift, just because I can do it doesn't mean that I'm going to. Because if it starts getting to the point where you look unnatural and it looks stretched, I don't raise it all the way up. And finally, and this is the least concrete one, it's intuition. While I'm operating, I really listen to my intuition. And if it's telling me, do this, don't do that, I trust it. I have over 25 years of experience in the operating room enough to trust my intuition.